Ladies and gentlemen, welcome back. Your BACC Board President, Pamela Ratliff.
We hope that you've been enjoying this day of sharing knowledge and inspiring hope. We're coming to the end of the day and have one final plenary session together. We couldn't think of a better person to end the day with than Dr. David Spiegel. Dr. Spiegel is going to provide us with some helpful tools that we can all take with us and implement into our daily lives for practicing mindfulness. Mindfulness is a wonderful tool that can be practiced at any time, anywhere. Dr. David Spiegel is the Wilson Professor and Associate Chair of Psychiatry and Behavioral Sciences and Director of the Center on Stress and Health and the Center for Integrative Medicine at Stanford University School of Medicine. He has published 13 books, 409 scientific journal articles, and 175 book chapters on hypnosis, psychosocial oncology, stress physiology, trauma, and psychotherapy for stress, anxiety, and depression. His research has been supported by the National Institute of Mental Health, the National Cancer Institute, the National Institute on Aging, the National Center for Complementary and Integrative Health, and a number of foundations. He is past president of the American College of Psychiatrists and the Society for Clinical and Experimental Hypnosis, and is a member of the National Academy of Medicine. He spoke on hypnosis at the World Economic Forum in Davos in January 2018. He was a member of the Medical Advisory Board and the Board of Directors of Bay Area Cancer Connections. Ladies and gentlemen, welcome Dr. David Spiegel.
Good afternoon. It's an honor and a pleasure to be here at the BACC annual meeting. I've had the privilege of working with BACC for some 15 or 20 years, and the organization embodies some of what is most important in cancer care, which is mutual support, knowledge, and management of mind and body. And so I'm very happy to be able to speak with you today. What I hope to do is share with you some of what we've learned over many decades of research about minding your body, about helping you deal well with the illness and its effect on yourselves, on your family and loved ones, and using the power of community and your mind to help deal with it better. I have a disclosure, which is that I'm co-founder of Reverie Health, a digital interactive hypnosis program that I plan to tell you about later in the talk. I wanted to make it possible to share what I do in my office with people anytime, anywhere on the internet, and I'll show you more about that. Let's see here. We go to the next. There we go. Okay. Oops, sorry. You know, I'm getting a very small image of what I'm projecting on the screen. Is it possible for that to be bigger for me? Maybe not, but if you can, that would be good. What I hope to do is talk with you about, here, I'm going to just do a little adjustment here on my own screen. Thank you. About cancer-related stressors. So minding the body is meant to have a double meaning. It's both we mind what our body does, what happens to it, and we can also control it by minding it, by paying attention to it. So I want to talk about cancer-related stressors, about some of the physiological manifestations of stress hormones, depression, sleep, and effects on the autonomic nervous system, heart rate variability. I want to talk about the power of psychotherapeutic support, both group psychotherapy as well as mind and body management techniques like hypnosis and mindfulness, and the availability of digital hypnosis. And I'll look forward to discussions at the end. I want to, there we go. There was an article the other day in the New York Times by Jane Bode about past connecting mind and body. I talked with Jane Bode, who's a terrific science writer in the New York Times, about ways in which psychological stress and disruption of circadian rhythms can have profound effects on the mind and the body. How we can get into a cycle of distress in which we don't sleep well, we don't eat well, we don't exercise much, and it can contribute to depression. And depression is one of, as well as anxiety, a number of ways in which we may react to stressors, including cancer and certainly including the pandemic we've all been living through, in ways that can compound it and make matters worse rather than better. So it's good to be aware of that. But I think what Brody's article in the Times underscores is the interconnection, the deep, complex interconnection between brain and body, and how things that happen in our brain affect our body, things that happen in our body affect our brain. And that's something that we can use to better understand how to cope better with an illness like cancer. There is stressors proliferate. And these days, as we all know, the stress of the pandemic, in addition on top of cancer and the discord and disagreeableness in our country, the climate change that's happening, all can pile on as stressors. Disruption at work, facing the fear of infection, decisions about our safety, our social environment, the financial pressures that come up, limitations in physical abilities, changes in family roles, and existential issues that we're all facing together add to the burden of stress that we need to learn to cope with effectively. And I hope to provide you with some information about how to do that. We did a study at the beginning of the pandemic in which we sent out a series of questionnaires around the world, particularly studying perceived stress. And Maheen Adamson at Stanford and a bunch of my other colleagues worked with me on this. And we looked at factors around the world through this internet survey that seemed to modulate stress. We gave the perceived stress scale. We got 1,685 survey responses. And what it showed is, in general, people around the world were at least moderately distressed. That's the orange color on the map that you're seeing here. The areas with low stress, and there weren't many, you can see in yellow, and high stress you can see in red. The factors that moderated how stressful the situation of the pandemic were, would interest you to know that female gender was one of the biggest ones. So just like everything else in life, women seem to be emotionally affected more than men. Secondly, it will make you feel good to know that if you held a 4-year graduate degree, you were even more likely to be stressed. So education can protect you, but it can also sensitize you. Interestingly, people over 75 years had lower stress levels. And the good news is that personal care, like hours of sleep, exercise, and meditation, were associated with lower stress. So there are things you can do. If you take care of yourself and your body, you're less likely to feel deeply stressed. And so there are things we can do. And other studies have shown as well, interestingly, that the age group that seems to be most affected by the pandemic are not the people who are most vulnerable to serious illness from the pandemic. Actually, as in our study, relatively older people showed less signs of stress. It was people between 18 and 30 who seemed to have the highest stress levels. And if you think about it, these are the people whose job in life is to cut themselves loose from their families of origin and make new friendship networks and families of their own. And the pandemic has sure interfered with that. You know, virtual contact can only go so far. So we need to keep in mind that some of the people who are most affected are the youngest and otherwise healthiest of us. And social connection is tremendously important. This is from a study done a number of years ago, showing the extent to which not just our quality of life, but our quantity of life is associated with social connection. So these are studies showing a link between low and high social integration, low on the left, high on the right. And it shows that the age-adjusted mortality rate is directly associated with low social integration. In fact, the effect of social isolation on mortality is as high as the effect of smoking on mortality. So, if you think about it, humans are the most vulnerable creatures as newborns, as you'll find. And the way in which they survive is by forming and sustaining social connections with their loved ones, the people who care for them. So from the time we're born, our survival is dependent on social connection, on maintaining it, and on receiving it. And so it's a lesson that social support is not just a nice thing, it's a necessary thing for coping well with illness. So this is just a reminder that mind and body form a two-way street, as you'll see on the next slide. I hope, there we go. And what the doctor is saying on the right is stress is killing you. You need an easier job, a smaller house, and a different family. We can't do all of those things. We shouldn't. But we need to keep in mind what makes us stressed. This is from a study that we published some years ago in the Journal of Clinical Oncology, showing a direct relationship between the course of depression and subsequent survival with metastatic breast cancer. So what it shows is that during the first year, there wasn't any particular relationship, but over the ensuing 10 years, if your depression scores were going up, your survival time was going down. And conversely, if you were getting less depressed, your survival was getting better. So what it means is that treating, and this isn't being depressed just shortly before you're at risk of dying, it's years before. And it suggests that taking care of your mental health in terms of a variety of things, getting depression treated with psychotherapy or medication and social support groups of the kind that Bay Area Cancer Connections provides, is a part of your medical care. It's a part of your cancer care. It's not something separate or a nice thing to do if you have the time. It can actually make a difference in overall survival. And this shows you the magnitude of the difference, that if the depression scores were decreasing, median survival was 53 months. If they were increasing in the first year, there was 25 months. So it makes a real difference. And we need to take it more seriously than, frankly, we have been. One of the things that affects survival and your health is the regulation of stress hormones like cortisol. Cortisol is one of the leading stress hormones that is secreted by the adrenal glands. It raises glucose in the blood. That's why they're called glucocorticoids. And it prepares you to fight or flee. The line in the middle shows a nice normal circadian variation in cortisol. Our cortisol levels when we go to sleep tend to start to rise in the early morning. A French colleague of mine said, qui dort dîne, those who sleep also eat, because cortisol increases secretion of glucose in the blood. And then it starts to go down. The highest point is just after you wake up. It then declines throughout the day and should be at its lowest level just before you go to sleep. But you see that people with major depression, the green line above, tend to have flat, unvarying cortisol levels. And that takes a toll on your mind and your body. And at the bottom, people with illnesses like PTSD tend to have low and flat cortisol levels. So losing that circadian variation is not good for your body, and it's not good for your mind either. And what you see, let me see here, sorry. In the next slide here, is the pattern of survival relating to cortisol. So the blue line are people with nice normal cortisol levels, high in the morning, low in the evening. And you see that the subsequent survival time over the next 10 years for women with metastatic breast cancer is much better than it is for those with flat slopes. So, I've got the colors wrong here. So The steep slope are the ones who have longer survival, less hazard of dying, and the blue, the ones with more hazard of dying. So the main point is that normalizing your cortisol, normalizing your stress, and dealing with it in terms of wakefulness during the day and good sleep at night is a way of not only improving your mental health, but your physical health. Another example of the stress-related story is the noradrenergic system, the sympathetic nervous system. That's the other part of the fight or flight response. When you're acutely stressed, your heart rate goes up, your blood pressure goes up, and you are ready to fight and flee. An excess of that kind of arousal, it turns out, can also stimulate blood vessels in areas where tumors grow. And there have been a number of studies based on this that have shown that breast cancer patients who are receiving beta blockers, which are often given for high blood pressure, actually seem to have better survival as well. Now, this hasn't been done in randomized trials, but it's been observations in large numbers of studies. And I'll show you an example here, that the ones with beta blockers, the yellow lines, live longer than the breast cancer patients without receiving beta blockers. Now, they may be different kinds of patients. This is not a definitive proof, but it is evidence in a large number of patients that being able to manage and block your stress response can sometimes add to survival as well. One way of doing that is to get better sleep. So we found in studying our participants with breast cancer that those who have the steep slope tend to have fewer awakenings during the night, whereas those with a flat slope tend to have more awakenings during the night. So sleep efficiency, being able to go to sleep and stay asleep, is one way in which the system resets. And I think most of us don't pay enough attention to that third of our lives that we spend in bed asleep. But it's a restorative time, both for our bodies, normalizing cortisol slope, and for our brains as well. We're learning more and more that sleep is a time when the brain prunes synapses, when it rebuilds itself every night based on learning and experience during the day. People learn better and feel better if they've had a good night's sleep. And changing mental states, like going to sleep and waking up in the morning, is a very important adaptive mechanism. And you know that if you made the mistake, like I often do, of reading email before I go to sleep, and I get some nasty email, and I don't know what the hell to do about it, and it's upsetting. And I wake up the next morning, and I look at it, and I know immediately what to do, and no big deal. So the restoration of given us by sleep is a stress management and adaptive mechanism that can help us cope much better. So in many ways, sleep and health are closely related. We spend a third of our lives asleep. We're now doing more research on the endocrine, immune, and health-related effects. Nearly half of adults between 55 and 64 report having insomnia at least a few times a week. Disrupted sleep leads to fatigue, irritability, the development or worsening of depressive and anxiety disorders, substance abuse, and reduced social support from partners. And sleep inefficiency predicts shorter survival with cancer. One story that might interest you is some lovely participants joined us in one of our NCI-sponsored studies, which they came into the laboratory to sleep overnight, and we could measure their hormones as well as their sleep patterns using EEG. One of the things we found that surprised us was not only did married breast cancer patients sleep better at home, because we monitored their sleep at home as well, but they slept better in the laboratory when their spouses weren't with them. So there's something about having a stable and warm social connection that goes with you even if you're not sleeping with your partner, and that's something to remember. So thank your partner the next time you see them about that. In fact, Oksana Polish, who is now an associate professor at Stanford, did a very interesting study in which she looked at the relationship between monitored sleep. We used actigraphs that are something like these Apple Watches that we all have now, and they can record interruptions in sleep during the night. And we found that those who had less interruption of sleep in the night actually had longer survival over the subsequent 8 years. So it's getting a good night's sleep is an important part of your breast cancer care, as well as just making you feel better and nicer to your family. We looked, Dr. Polish, Jamie Zeitzer, who is a sleep expert at Stanford, and a number of other colleagues, and I looked at vagal regulation. So there are two components to the sympathetic nervous system. I mentioned earlier the sympathetic one that increases heart rate and blood pressure, but that's the accelerator pedal on response, but there's a brake as well, and that's the parasympathetic nervous system, the vagal system that slows heart rate and lowers blood pressure. And we found that, and one way of measuring heart rate, increasing heart rate is a good way of measuring the sympathetic nervous system. The parasympathetic we measure using EKG by variability in heart rate. So it is healthier to have heart rate that varies slightly, that isn't the same boom, 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 1 beat a second, but rather varies. And heart rate variability, which is induced in part when you inhale versus when you exhale. When you exhale, you slow your heart rate down because you increase pressure in the chest. When you inhale, you increase heart rate because there's a slight drop in blood returning to the heart, and so the heart rate picks up. And the capacity to vary your heart rate based on these subtle differences in demand for heart pumping is a good measure of heart rate variability. Heart rate variability, as you see in this paper, predicts longer survival with breast cancer. It also predicts better recovery and survival after a heart attack. So it's very good to cultivate these self-soothing approaches. Get your body to practice reducing its heart rate activity. And so here is an example of how heart rate variability, and this was Janine Giese-Davis in our lab and other colleagues, Helen Kramer and Dr. Polish at Stanford, showed that those who had higher heart rate variability, that's the darker gray line above, had longer survival. And there have been a number of studies of various kinds of cancer that showed that better capacity to self-soothe is associated with longer cancer survival. Well, how do we make this happen? I want to devote the rest of the talk to describing for you the things we can do to help us live better and, in fact, potentially live longer as well. For many decades now, we have been conducting support groups, and many of the groups at Bay Area Cancer Connections work with these principles. We have called supportive expressive group therapy. It was originally started with my colleague Irvin Yalom, who is a good friend and colleague. He's now at the ripe old age of 90 and still interviewing patients remotely and writing another book. He sends his greetings to you. And we developed this type of intervention at a time when people were frankly afraid that we would demoralize breast cancer patients. The reason we convened these groups was the thought that, the existential philosophers say that you don't really live authentically until you face the possibility of non-being, that can be a period of growth, not decline. And we thought, well, if we bring women together who are dealing with these issues, maybe they can help one another. Maybe they can grow in many ways. And we were warned that we would demoralize them, that they would see members of the group die. We were very worried about that. We monitored it very carefully. But we also noticed that they didn't demoralize one another, they remoralized one another. That they drew strength from seeing other people. They could see in other women with breast cancer things about themselves that they didn't recognize. It's easier to admire how someone else is coping with the illness than sometimes to see it in yourself. I remember one group where one of the women, who was a just delightful lady who was particularly notable for being impeccably dressed and coiffed at every meeting. She always presented herself beautifully, even though we could see that she was getting sicker. And one day she comes in and says, my husband is a banker, but he's not a teller. He doesn't talk. And I have a feeling that he's had it with me, and maybe it's time for me to just go. And she was talking about perhaps shortening or ending her life. And one of the rules of running groups like this is that you keep it in the room. We could have talked about what her husband was like, but he wasn't there. And so I said to the group, I think she's asking us a question. Are we tired of her? Would we rather she not be there? And she got just a wave of feedback about how much people admired her, how much they admired the fact that even with all the problems related to the illness she was struggling with, she came every week and kept herself looking beautiful. And that there was no way they wanted her to leave. They wanted her to be with them as long as she could. Well, she didn't do anything to shorten her life. She died about 3 months later. And in her will, she left a provision that a bus would appear at the building where the group met to take all of us to her memorial service. So clearly it meant something to her. And that's the kind of things we do in those groups. There are 7 themes. The first is building bonds of social support. You realize, just many people with cancer, I don't need to tell you this, but many people with cancer feel like suddenly they're cut out of the usual flow of life in the world. Now, the usual flow of life in the world is pretty bad these days, but still having cancer seemed to separate them from the rest of the world. And it became the ticket of admission and the source of bonding within the group. The second theme, and this is a critical one, is expressing, not suppressing emotion. It really kind of makes me uncomfortable when I hear people talk about, oh, you know what? I'm not showing you the right slide here. Let's see here. There we go. When I hear people talk about she was very strong, meaning that she didn't show feelings. And that's a mistake. Pretending that you're strong when you're not, pretending that you're not upset when you are, not dealing directly with anger, fear, and sadness is a mistake. And I tell people, people in our group cry and they stop crying. I've never lost a patient in terminal crying. And it's dealing with we have these feelings for a reason. They're telling us what's important and what isn't. And if you can express them and talk about them, you can do something about them. And so it's a source of connection. It's not a sign of giving up. The third is detoxifying dying. We ask people to talk about their fears of death, face them directly and put them into perspective. And doing that doesn't weaken people, it strengthens them. They feel, one woman in one of our groups said that being in the group is sort of like that fear you have of when you look into the Grand Canyon. She said, I'm afraid of heights, but you feel better about yourself because you're able to look. That's how I feel about death. I'm not happy about it, but I feel better because I can look at it. The fourth thing we talk about is reordering life's priorities. If we're not going to live forever, how do we want to live the time we have? Value it, use it as well as we can, so that there are the fewest regrets about things that we didn't do. Irv Yalom did a study once of people at the end of life, and he said that the interesting thing is when people said when we were younger, we were afraid of doing or saying the wrong thing, of what we did. And they said toward the end of the life, the regrets were about what we didn't do. So don't leave any stones unturned. Do the things that you want to do that matters. The fifth feature in these groups is fortifying families, improving communication with families, express appreciation to family members for what they do for you, and find out what you can do for them. And it's particularly important to realize that no matter how ill you are a very important member of your family. You're setting an example for younger generations. And what you do, think about not just what the family can do for you, but what you can do for them. We had one member of our group who was a faculty member at UCSF who was very ill at one point and was in bed. And she heard her husband trying to cook dinner, and she had a young child, and the child was saying, "Can you help me with my homework?" And he said, "I'll do it after dinner. I'll do it after dinner." And he heard his wife screaming from the bedroom, "I can't cook. I can't clean. The one thing I can do is help our son with his homework. So I'm going to do it. Send him in here." And that was just the right thing for her to say. We try to clarify communication with physicians, make sure that you get your questions answered, that you're happy and comfortable with your participation in the decisions that you're making, and you feel in control of your care, not just a recipient of it. And finally, managing symptoms, and we'll talk some more about that techniques like hypnosis. So in managing distress, we try to convert anxiety into fear and depression into sadness. Anxiety is just an overwhelming feeling that everything's wrong and you don't know what to do. Fear is, I see something I'm afraid or worried about, how can I deal with it? The same with depression. If you're feeling hopeless, helpless, and worthless, it's hard to know what to do about it. But if you're sad about something, you can do something about that. So try to redefine your distress in ways that give you opportunities to deal with it and do something. One way of summarizing this is to use the acronym FACES. Stresses are best handled by facing rather than fleeing them, by altering your perception of what you're dealing with and how you deal with it, by coping actively. Find some aspect of it you can do something about. Express rather than suppress emotion, and seek social support. Face it. Shakespeare, of course, said it best. In Macbeth, he wrote, "Give sorrow words, the grief that does not speak, whispers the oft-wrought heart, and bids it break." I didn't memorize that. I have a slide. There it is. Okay. So what was the effect of participating? We did a randomized clinical trial, 50 women randomized to one of 4 support groups, 36 to a control condition. And here we, over 4-month intervals, plotted their responses on a scale of mood disturbance. And what you see is that over that year, the control group was getting worse and the treatment group was getting better, and the difference was statistically significant. And we were glad to see this because this was done in the late 70s, early 80s. We were really worried that we might be stirring people up and making them miserable, and we weren't. They were feeling better, not worse. And we repeated the study some 15 years later, and we got basically the same results. And people not only felt better, but they reduced what we called their emotional control, their tendency to suppress their emotions. And you see the yellow line as the women in our support groups who were getting less controlled, and the red line is the group that were doing were the control condition, where they were having more, not less, emotional control. And I remember one woman in the group, she was a newspaper journalist and an editor, and she said, I'm 15 minutes late, and I know, Dr. Spiegel, you don't like that, and you're going to tell me, that I should have arranged things to be here on time. But you also taught me not to worry about things that are not very important, and this is one of them. So if you're unhappy, too bad for you. And I said, good for you. You got the message. So living life differently in the face of things can be very helpful. And they felt, there's a measure called cancer self-efficacy, how emotional self-efficacy. And patients who learned to do that felt better. They felt that they were managing their emotions better, even though they were less suppressive of them. We found that their overall stress scores declined significantly more than the control patients. So it's pretty clear that this emotionally helps people. There was a study published, it's called a meta-analysis. This is a combination of results from a number of studies. It's a technique that's widely used now, published in the Cochrane database, which is sort of the Bible of meta-analytic studies. And there were 6 studies for cancer patients helping them with depression. And you see that our original study was on the bottom there on the left. And the meta-analysis showed that in group support, psychotherapy reduces depression, even serious depression, among participants with cancer. So it works. It helps people reduce their depression. Perhaps the biggest surprise came in 1989. We finished our first set of studies in the early 80s and published these emotional results that I showed you about. It was a time when there was a book out called Getting Well Again by Carl Simonton, a cancer radiologist who had people visit his ranch in Texas, and he taught them to visualize white cells killing cancer cells and concluded that they were living longer because the women who came to his program did better than the average patient. Well, it was pretty clear that the women who could get there, and men, were not average patients and had more resources and better health to be able to do it. So I wasn't convinced. So we followed up on the women who had been in our original first randomized support group program. And what you see here is a survival curve for women in the control and the treatment condition. That's the solid white line is the ones in the treatment condition. The dotted line was the women in the control condition. And you see that there was a significant survival advantage for patients who were randomized just to supportive expressive group therapy. They lived on average 18 months longer than the control patients, which is a non-trivial difference in survival. And I was shocked and surprised by it. We were published in the Lancet showing this survival advantage. And you see that most of the participants did eventually die of breast cancer, but they lived a lot longer. And two things about it: there were no differences in their medical treatment that could account for this. And the life that the ones who lived longer lived was a good life. It was not that they were hanging on, they were living as fully as they could. And so this study got a fair amount of attention. We have done our own meta-analysis recently with Dr. Helena Kramer and Bawil Joe and Spila Mirosevic, Mona Rashadi, Eric Neri in my lab. And what we found was, looking at all the randomized trials of providing emotional support for cancer patients and others of various kinds, that there is a survival advantage. The risk of dying goes down for those randomized to get emotional support. So minding your body means business. It makes a difference not only in your quality of life, but in your quantity of life as well. One related thing that might interest you is that marriage matters. This was a study published a few years ago in the Journal of Clinical Oncology out of the Dana-Farber Cancer Center. And they looked at the SEER registry, which is the NCI's registry of all cancer patients in the United States. And so they had a sample over 5 years of 734,000 cancer patients. And they asked a simple question: does marriage matter in survival? And the answer was yes, that all in all, patients with all 10 kinds of cancer lived significantly longer, those who were married, than those who didn't. And they looked at the time to initial diagnosis. Were they diagnosed earlier? Yes. Did they get more vigorous treatment? Yes, because their loving partners bugged them to get all the care they could. But even when you controlled for that, they lived longer. And in the abstract of this paper was 4 months overall difference in survival. And in the abstract, the authors wrote that the effect of being married is as strong in terms of added survival time for all cancers as chemotherapy is. So take mind mattering seriously, because it makes a real difference in survival. It might also interest you and not surprise you that the marital status advantage was bigger for men than for women. The research shows that for men, being married is a tremendous support for your health. For women, relationships with other women as well as your marital partner is good for your survival. So if you're a man, being married does your health a lot of good. If you're a woman, being married does your health some good, but you're doing his health a lot more good. Let's see here. So Shakespeare again: when we are betters see bearing our woes, we scarcely think our miseries our foes. The mind much sufferance doth o'erskip when grief hath mates and bearing fellowship. Now I want to spend the last bit of time talking about some other techniques that can be very helpful in coping with pain, stress, anxiety, insomnia, and cancer. Hypnosis helps. Hypnosis, as you see imaged here, is a state of highly focused attention that we call absorption, the kind of state that hopefully you're in when you're skiing. You better pay attention to where you're going and nothing else, or you'll wind up in the snow. And to do that, you have to dissociate or disconnect your awareness of other things that ordinarily might preoccupy you and respond to suggestion or instruction. Suspend critical judgment and just take in something new and do something with it. It's like looking through the telephoto lens of a camera. What you see with great detail, but you're less aware of what's going on around the edges. We've been doing magnetic resonance imaging of brain function for people in the hypnotic state. And what we find is that in hypnosis, you turn down activity in that area circled in yellow there. It's called the dorsal anterior cingulate cortex. It's part of our salience network. It detects conflict, tells you what to pay attention to and what to ignore. And if you turn down activity in that area, you're more likely to devote your full attention to what is at the center of your attention. And you see the graph on the right shows that the more hypnotized people felt in this study, they were hypnotized in the scanner, the more they reduced activity in the anterior cingulate cortex. Hypnosis is also involved with better mind-body control. So there's a connection between the dorsolateral prefrontal cortex, which is part of our executive control network, and the insula, which is a mind-body pathway. And so it's a route by which the brain can control what's going on in the body, and I'll show you some examples of that. And you also disconnect from the posterior cingulate cortex in the image on the right there, the back image there, that says self-awareness. It's a part of the brain that is more active when you're not acting on something or planning or doing something, but reflecting on yourself. It's a part of the brain that in mindfulness, the activity goes down. And here you disconnect it from your executive control network. So you're able to just focus not on what things mean to you, but on what you want to do and on how you can control your body. We've also found that to the extent that you're more hypnotizable, you have more inhibitory neurotransmitters in that dorsal anterior cingulate cortex. Those are the same receptors that are affected by benzodiazepines like Valium and Xanax. So there you have a greater capacity to inhibit your brain arousal, and you can use that capacity when you experience things like hypnosis. Hypnotizability is a very stable trait. So some people have it more than others. Most children are highly hypnotizable. You know that if your 8-year-old is outside playing and you call them in for dinner, they don't hear you. And the wonderful thing about childhood is play is like work. And work is like play. Work is like play. They get so absorbed in what they're doing that they enjoy it, whatever it is. And but when you get to be adults, you get to be very stable in your hypnotizability. And about a third of adults just aren't hypnotizable. About 15 to 20% are extremely hypnotizable, and the rest are somewhere in the middle. And it's as stable a trait in adult life as IQ is. So how do we use it? This is a picture of Bode Miller in the Sochi Olympics. Among the many terrible things Putin did, he scheduled the Olympics. You can see there wasn't a hell of a lot of snow, but he wanted it there, so he made it there. So they could only do one practice run before they competed. And what the American team did was they went up to the top of the run, looked up, closed their eyes, and imagined what it would be like for them to go down the run and practice every turn. And that mental rehearsal made them very effective competitors. So the team did extremely well by just doing the mental work that would be involved in skiing the run. The kinds of techniques we use to help people with anxiety is to imagine they're floating in a bath, a lake, a hot tub, or floating in space, or imagine somewhere they'd rather be. And if you think about it, one way of controlling stress is to control your body's reaction to stress. You feel it physically. Your heart rate goes up, your muscles get tense, you start to sweat, and then you think, oh God, this is really bad. And then you get more anxious, and then your body says, now she's getting more anxious. It's like a snowball rolling downhill. And if you can just interrupt or control the physical reaction to the stress, you start to feel that you're handling the stressor better, and you can deal with it better. For sensory problems like pain, you can imagine warmth or coolness, tingling, or focus on sensations in another part of your body. And I'd like to give you, if you would like, a little exercise just to see what it feels like. If any of you who don't want to do it, that's just fine. But for those who do, let's give it a try and see what it feels like. So get as comfortable as you can. If you're driving, pull off to the side of the road. Now look straight ahead, then look up to the top of your head, all the way up. And as you look up, slowly close your eyes, take a deep breath. Let the breath out, let your eyes relax, but keep them closed, and let your body float. Imagine you're floating in a bath, a lake, a hot tub, or just floating in space. Each breath deeper and easier. Now take another breath in, stop, and then inhale even more deeply. Fill your lungs as much as you can, and then slowly exhale, very slowly. Now, please picture in your mind's eye an imaginary screen. It could be a movie screen, a TV screen, a piece of clear blue sky, and picture a pleasant scene, somewhere you like to be. Now, notice how quickly and easily you can use your store of memories and fantasies to help yourself and your body feel better. Each breath deeper and easier. Now divide the screen in half. Keep your body floating, but on the left side, just picture one thing that's causing you stress or worry right now. But with the rule that no matter what you see on the screen, you keep your body floating. Now use the other side of the screen as your brainstorming, your problem-solving screen. Picture one thing you can do to deal with the problem on the left. So your body is floating, worry screen on the left, brainstorming screen on the right. Now notice how you can use this state to help your body feel more comfortable and to face one at a time some of the things that cause you stress or concern. Now take a few moments to reflect on what this means to you in a private sense, and then when you're ready, bring yourself out of the state of self-hypnosis by counting backwards from 3 to 1. On 3, you'll get ready. 2, with your eyelids closed, roll up your eyes, and 1 open. Ready? 3, 2, 1. Now, I hope there's just a moment of calm and peace, and you see how quickly and easily you can learn to regulate your mental stress, but also your physical stress and the way the two of them interact with one another. So we've learned that problems like pain as well can be modulated by hypnosis. And Lord knows with the horrible opioid crisis we have with 90,000 needless deaths with opioid overdoses every year, we need to find ways of using non-pharmacological ways of handling pain as well. And the strain in pain lies mainly in the brain. And I'll show you some examples of how we can deal with that. There are 2 pain regulation systems. One of them involves bottom up, the thing you see on the left, pain signals going through what's called the lateral spinal thalamic tract up into the brain where it's processed. But there are also top-down ways of regulating pain in which the cortex of the brain can modulate perception of pain. And that's something we can use with hypnosis. As you can see here, this little boy is getting what I hope a lot of children are getting, maybe not this young, a vaccination. And you can see that the baby finds it kind of interesting. The father is the one who's in pain. So it's your perception of the experience that tells you how much pain you may be experiencing. And this is a study we did some years ago looking at the way in which hypnosis can affect the brain's reaction to pain. So we gave a series of electric shocks. And the red line is the normal response to these shocks that felt like, snapping your fingers on your wrist. The yellow line, you'll notice, is much shallower. And that's the same shocks, the same people, but they were hypnotized and told that their hand was cool, tingling, and numb. And so from the very beginning on the left, you see that the line is much flatter. And that meant the brain was reacting much less to the same painful stimuli. And this is a functional magnetic resonance imaging study done by colleagues at the University of Montreal. There we go. And you see that just the way the language you use makes a difference in which part of the brain reduces the pain. So if you give a sensory suggestion, as I mentioned a minute ago, cool, tingling, and numb, you reduce activity in the somatosensory cortex there on the upper level. If you say the pain's there, but it won't bother you, on the lower right, you see reduced activity in the anterior cingulate that I mentioned before. So you can change the part of the brain that modulates pain depending on what your instruction is. We've shown in randomized trials, and I know we're coming near the end of time, so I'll go through this rather quickly, but just mention that we could, in a randomized trial of patients undergoing painful procedures, arterial cut downs, that they had significantly less pain if they were taught self-hypnosis. And that's the orange group on the bottom, than the yellow one at the top. They could all push a button and get IV opioids, but the ones at the bottom used half as much opioids. And by the end of 2 hours, they had pain on 1 out of 10 scale, whereas it was 5 out of 10 for those who were getting standard care. They had less anxiety. I was afraid they had died or something, because by the end of 2 hours, they had no anxiety at all, and the anxiety level was 5 out of 10. The procedures were shorter by 17 minutes on average as well. They used half the pain medication, and they had fewer complications as well. So again, this is a way in which your brain can actively control how much discomfort you have. Let's see here. I'll get this to move, I hope. All right, there we go. And we found that this is true for chronic cancer pain as well. The women in our support groups learned self-hypnosis. And by the end of the year, the treatment group, the green ones, had half the pain the control group did on the same and very low amounts of medication. And this, we were able to replicate that in subsequent studies as well. So it's very clear that you can use your mind to control the pain in your body. He's saying, oh, there we go. Sorry, pushing the wrong buttons. Here we go. I hope, there we go. He's saying the way we treat a headache is divert your attention to something else. We do it a little better than that. It's been used, hypnosis has been used to help people undergoing breast biopsies and even lumpectomies. And it can be very helpful and avoid the complications of anesthetic medication. This is my daughter's depiction of what I did when she was a little girl. She said, my dad hypnotizes people and makes them want to live longer, and you see a particularly successful clinical example there. She's now an attorney, and this doesn't represent her current level of artistic ability. So finally, I want to mention Reverie Health, and we have now developed a series of stress apps, and stress and insomnia and pain and eating control apps that are just like what I do in my office, including being interactive. So I ask questions, and depending on the answer you give, you get a different instruction. So it's as much, we made it as much as we could to be like the experience you would have in my office. The apps are free to be downloaded at the App Store. Just download the Reverie, R-E-V-E-R-I app, or at Google Play, and you can choose any one of these 6 problems that you can learn to deal with. And for pain relief, there are 4 different exercises. Imagine tingling, numbness, being in a pleasant place, being kind and compassionate to your body, not frustrated with your body, or moving the pain around. And we're finding that this is very helpful to people. They reduce their pain by an average of about 35% at 3-month follow-up, just from doing using the hypnosis app on Reverie. There's an example of the pain reduction that we get. Patients said, I just want to stay here. I feel so relaxed. It guides you through a relaxed state otherwise you wouldn't be able to do for yourself. I like the fact that it's taking input from me and giving me choice as opposed to, say, calmer headspace. We find that we're getting about a 30% reduction in pre-post pain from teaching people to use the self-hypnosis app for stress. And we've just completed a study involving 15,911 people who use the app. We've had 105,000 enroll at the app site so far, and they get a huge reduction in pain, in stress, about a 35% reduction in stress just from doing this app. So it can have a real tangible effect. We've got a Spanish translation, and we're getting the same kind of stress reduction effect doing it in Spanish. We're helping people stop smoking. We've got a 38% response rate at about a month after using the app, and others are cutting down on the amount of smoking they do. So there are a lot of ways in which what I've been doing with my patients in the office we can do now, and give people the opportunity for repeat use. And we're finding that the people who do best with the smoking app use it every day. They practice every day, but that's easy to do. You've got your phone with you all the time. You can do it that way. And they're reducing the number of cigarettes they smoke for those who don't quit by about 4 cigarettes. We've been written up in the Wall Street Journal. I'm just about done, Colleen. I hope you will take advantage of it, and I would be delighted to hear from you about how it works. One woman said that it was some crazy ass voodoo shit, and I mean this in a good way. She liked it, and she said, "I'm amazed I stopped smoking. None of my friends thought I could." So it can be very helpful. I will move on to just mention that there are people in 130 countries around the world who are using it now, and we hope you will join. Welcome to Reverie. Mindfulness is similar, but it's less focused on problem solving. And we have mindfulness at our Center for Integrative Medicine at Stanford. And you're welcome to contact us for help there. And of course, Bay Area Cancer Connections is a wonderful source of support as well. This is my final thought. We need more of this because there are things in the system that make it hard to do. The doctor's saying, "I'm sorry, Mr. McConnell, your insurance plan only provides for empathetic nodding and a saddened downward glance. But please do take advantage of the things, the group support, stress management, treating depression, making the most of your family and friends, sleeping and handling stress better, and you can live better while living with cancer. It can be an occasion for growth. And I want to thank the support that has helped us to be able to do this research. I will just close with this slide, if I can get it to show up there. The guy at the right is saying I was close to a breakthrough when the grant money ran out, but we've been the fortunate recipients of support from the National Cancer Institute, National Institute on Aging, the National Center for Complementary Integrative Health, National Institute of Mental Health, California Breast Cancer Research Program, the Dana and the MacArthur Foundations, and I'm very grateful for that support. And I've enjoyed the encouragement I've got from working with Bay Area Cancer Connections and seeing how the staff and the participants in the program benefit one another. Thank you for your attention.
Thank you so much for that wonderful presentation, Dr. Spiegel. It was empowering, enlightening, and your sharing of tips and tools is also extremely helpful. And we appreciate your kind words as well. I learn so much every time I hear you speak. And with that, we will move into a few questions before we wrap up the day. So we will start with one question. Can the findings from breast cancer and sleep studies that you mentioned be translated to ovarian cancer?
We haven't done those studies, and I don't know how much has been done about ovarian, but I don't see why not. There's nothing specific about breast cancer itself as a cancer. It is a hormone-sensitive cancer, but then so is ovarian. And so the hormonal effects of better stress management might well translate to ovarian cancer as well. And, you know, the patients in my breast cancer group used to joke with me. They'd say, "Hey, doc, am I living longer yet?" And what I would always do is smile and say, "I hope so, but you're sure living better." And so, you know, it's worth doing no matter what.
Thank you. And the next question, can the findings Oh, sorry. Are the people in countries with less access to social media less stressed by COVID?
Well, I think people with less access to social media are less stressed by a whole lot of things. I must say, the stuff we've heard now about TikTok and Instagram and all that, and there are the effects of both transmitting outright falsities, making teenage girls worried about their bodies and their appearance. I wish that this, hugely enhanced capacity for us to communicate with one another. I had thought it would instantly translate into more social support. And sometimes it does, there's no question about it. But sometimes all it does is transmit not only anxiety, but disinformation about how to deal with the things we have to deal with. The absolute nonsense about how masks harm people and harm children, the ridiculous nonsense about, the dangers of vaccines and all that. Instead of building social coherence, which enhances health and well-being in many ways, it is people are tuning into their echo chambers and believing the nonsense that gets dished out there. And so we've got a real problem. And I think, it's a tremendous tool, but anything that has the power to help has the power to hurt. And we're seeing plenty of that right now.
Very true. Thank you. And we have time for one final question. And that question is about the support groups and the benefits that someone can get from attending them. And the question is about whether or not this is universal to all support groups, or if it depends on if it's a certain type of support group, a closed one, or one through a nonprofit or part of Stanford.
Only Stanford. No, that's not true. As I said, anything that has the power to help could have the power to hurt. In general, I think support groups are terrific things. They bring people together, and they've helped with Alcoholics Anonymous. There are a whole array of powerful tools like this. I think the crucial thing is I think groups that are led by well-trained leaders have an advantage, although there are some self-led groups that may be helpful. I think it's very important, if there's one rule, keep it in the room, but make it intense and real in the room. And if you find things are happening that make you uncomfortable, talk about it. Don't sit there and suffer. Or if you can't get resolution of it, find another one. But I think there are wonderful opportunities to find people in similar situations, find what commonalities you have, support one another, and grow together. And if it's doing that, it's working. And if it isn't, either make it work or find one that does do that.
Very helpful. Thank you. And with that, I just wanted to thank you again, Dr. Spiegel, for your wonderful presentation, and thank you, audience, for your engaging questions. With this, we will move into hearing a few closing remarks from our Executive Director, Rena Bello. Thank you again.
Thanks very much.
What an amazing way for us to conclude today's program with that informative and inspiring presentation. Thank you so much, Dr. Spiegel. And now, it is with great pleasure that I welcome back our amazing leader and the Executive Director of Bay Area Cancer Connections, Ms. Rena Bello.
Thank you so much, Pamela. And thank you, Dr. Spiegel, for that wonderful presentation. Helping us learn new ways to remain mindful and create resilience within ourselves was the perfect way to wrap up this day of sharing knowledge and inspiring hope. A huge thank you to all of our fantastic speakers who made the time to share their knowledge with us and who helped us navigate this new technology that we used this year. It was an incredible day. Thank you all for being here and for being an important part of our wonderful community. Your ideas and feedback are what we use to help us create this event each year, and we would be grateful if you can take a moment to complete our conference evaluation, which you will find here. You will also be getting an email from us with this information in the next day or so. All those who complete the survey will be entered into a drawing for 2 Amazon gift cards. The drawing will be held on Friday, November 12th, so please be sure to get your surveys in. I hope this conference proved to be an inspiring and transformative experience for you. Thank you again, and I look forward to hopefully seeing you in person for next year's conference. Take care.